Welcome to Health Hive. Boost your vision health with expert eye care advice. Hello and welcome to our video on ways to take care of your eyesight. Whether you're concerned about your current eye health or you simply want to maintain it, we've got you covered with expert tips. It is said that the eyes are the doorway to the soul, therefore maintaining good eye health is important, especially in this day and age when we are addicted to bright computer and phone screens all the time. A healthy eye care routine is essential for preserving good eyesight. Regular eye exams are crucial for identifying any underlying issues and ensuring early detection. So, make sure to schedule an appointment with your eye doctor at least once a year. Next up, protect your eyes from harmful UV rays by wearing sunglasses. Your eyes may be harmed by the sun's rays. Select sunglasses that completely or almost completely block UVA and UVB rays from the sun. Additionally, always avoid looking directly at the sun. UV exposure can lead to conditions like cataracts and macular degeneration, so it's important to shield your eyes whenever possible. If you're putting in or taking out contact lenses, wash your hands before placing them anywhere near your eyes. Control the air quality in your house or workplace. A humidifier can help maintain moisture in the air and avoid dry eyes. When pollen counts are expected to be high or the air quality index is low, stay indoors. Pet dander can irritate the eyes, so if you have pets, make sure to frequently vacuum and clean furniture. To avoid eye strain, rest your eyes frequently. Avoid prolonged screen time and take regular breaks. Frequently, extended screen use can result in computer vision syndrome or digital eye strain. Additionally, the blue light emitted from electronic devices can strain your eyes and contribute to digital eye strain. Holding tablets and cell phones at least 16 inches apart is recommended. Instead of holding the screen closer to your face to view small print, increase the text size. When using digital devices, think about wearing computer viewing glasses or a screen glare filter. These attach straight to a monitor or tablet and reduce the amount of light that screens emit. Headaches, impaired vision, dry eyes, pain in the neck and shoulders, and eye pain are all signs of digital eye strain. Try the 20-20-20 rule to aid with this condition. Take a 20-second break every 20 minutes to look at anything 20 feet away. Avoid using tobacco products or smoking. Smoking raises the likelihood of getting cataracts, age-related macular degeneration, and eye-related cardiovascular problems. Reduce your weight to lower your risk of having diabetes. Glaucoma and cataract development are both 60% and 40% more likely in diabetics, respectively. Get adequate rest. The eyes are refueled with vital nutrients while you sleep. Lack of sleep can cause eye discomfort, eye weariness, sore, dry, or watery eyes, and double or impaired vision. Maintaining a balanced diet is also key to keeping your eyes healthy. Foods rich in antioxidants, vitamins A, C, and E, and omega-3 fatty acids can help reduce the risk of vision problems. Include leafy greens, citrus fruits, walnuts, and fish in your meals to support your eye health. Visit a trustworthy eye doctor for yearly examinations. Despite having varying levels of education and experience, ophthalmologists, optometrists, and opticians all deal with eye care and treatment. There are various eye operations that can help with eyesight improvement. For instance, cataract surgery involves removing your eye's natural lens and replacing it with a synthetic lens. Ophthalmologists, eye doctors, do cataract surgery on an outpatient basis, so you don't need to stay in the hospital following the procedure. Surgery to remove cataracts is quite common and typically safe. LASIK surgery, often known as laser eye surgery, is to enhance vision. As an alternative to using eyeglasses or contact lenses, nearsighted, farsighted, and astigmatic people can get LASIK surgery. But not everyone is a good candidate for LASIK surgery. LASIK surgery is a method used to fix refractive defects, which affect how well the eyes focus. Its name signifies in situ keratomylosis with laser assistance. A surgeon will sculpt the cornea using a laser during the LASIK surgery. The cornea is the transparent window with a dome shape through which light is focused to create a picture on the retina at the rear of the eye. A person will have hazy vision if the light passing through the tear film, lens, and cornea is not properly focused on the retina. People who want to know if LASIK surgery is a good choice for them should have a thorough conversation with their eye specialist. They can ask any questions they may have and learn what to anticipate throughout the procedure and the recuperation phase. Taking care of your overall health is essential, as many chronic conditions like diabetes and high blood pressure can impact your eyesight. Maintain a healthy lifestyle by exercising regularly, managing stress, and getting enough sleep. Lastly, don't forget to quit smoking if you haven't already. Remember, your eyesight is precious, and by following these tips, you can take proactive steps towards maintaining healthy eyes. Thanks for watching, and don't forget to subscribe to our channel for more healthcare tips.